Hello, we are going to set up a pulmonary artery catheter for monitoring of pulmonary artery pressures and cardiac output. So, two different things that you have to set up. The first is pressure monitoring. The second one is cardiac output monitoring. So let's start with pressure monitoring. Pretty straightforward for most of our critical care nurses. We're just going to take two sets of pressure tubing and go ahead and spike a bag, put it on a pressure bag, and it would be a 500 cc bag of normal saline. Spike it, put it on a pressure bag pumped up to 300 millimeters of mercury, and then prime all of your tubing, all of your stopcocks in our normal way. There are, of course, two types of pressure tubing. There is the type without a vamp and the type with a vamp. The vamp should only be used if you're going to use it at all with the CVP, with the central venous pressure monitor. And that's because we could possibly draw labs through that. If you have an art line, we would prefer you do that and leave this pure for cardiac output monitoring. But if you think you are going to use it for labs, you can use a vamp on the CVP port. For monitoring of the pulmonary artery pressures, we do not want a vamp. It should just be the straight tubing, no vamp in it, so that there's nothing that we accidentally flush through the vamp out into the pulmonary artery itself. So the PA monitor just gets plain tubing. So we've got those all primed and ready to go. Then to hook it up to our monitors, you need to have a module or a brick, if you want to call it that, for your Philips module, which has a red port for pressure monitoring. And what we're going to do, by the way, if you're using an arterial line, you may have to have an auxiliary brick with a different pressure port. But in this case, we're going to take a double pressure pigtail so that we can now put two pressures into here. And we will go ahead and plug this in up here. And then we need two pressure cables plugged into that. The first pressure cable usually goes very easily, not much of a problem getting that in. The second one is a tight fit, and you sometimes have to do a little wiggling and jiggling until you kind of get it where it needs to go. And then make sure both of them are in there nice and snug. And we are now ready to go for our pressure monitoring. Okay, now we're ready for the second half of this, which is cardiac output monitoring. So the first thing we do is we get a CO, cardiac output module or brick, and we're going to just plug this straight into here, make sure it clicks in tight, and this one seems a little bit loose, doesn't want to stay in there real tight, but it's there. And so that is our cardiac brick. It has an orange port, and then we're going to go get one of these cables, which is a cardiac output adapter cable, which has an orange end on it. So we will plug orange to orange, and that thing doesn't want to stay in tight. We'll pretend that's in tight. Okay, yeah, sorry, that is just not working quite right here on our video. There. So on this cardiac adapter cable, what you should know is there's a little connector box, if you will, on the end. It does have a place to connect here, which has got a little brown port, and we're going to connect something there in a minute. And then it has a permanent cable that's attached to it that comes out here. This is called the thermistor cable, and we'll show you in just a second what that does. But for now, what we're going to do is we're going to get an inline temperature sensor, and it's got a little brown thing on it. We're going to do brown to brown, plug this in, and then these are ready to go for our next step. Okay, the next step is we're going to get our COSET, which stands for cardiac output set, which is also our injectate delivery system. So once again, we're going to spike a 500 cc bag of normal saline, no pressure bag on this one. We'll clamp it almost immediately, and then it comes like this with a stopcock system on it. And we are going to take this big syringe here with this double barrel pusher thing onto it, and we're going to screw that into the end, and then we are going to be ready to prime this. So to prime it, I need to unclamp And then we have to pull fluid all the way through all these coils. Now the coils are here because this is designed to be used for cold injectate. If we had very, very low cardiac outputs on our patient, we might get a little bit more accuracy. The vast majority of patients are just fine with room temperature saline, and that's what we generally use. But this is ready to put into an ice bucket if you should need that for somebody very low. So I am now going to leave this so that it will be off currently to the fluid. And I'm going to draw fluid up into here. Then I'm going to open my stopcock. Okay, it's not flowing through. Try that again. You need to do this 2 or 3 or 4 times until you get enough. Okay, now I see some fluid starting to come through. So I'll go ahead and push the air out and keep drawing until fluid is all the way through my system. And it sometimes takes a little while. It's coming. I can see fluid right to here. And now I've got fluid into the barrel. And now I want to do at least 3. Get some of the fluid to go out the side. And now I am fully primed, but I do want to fully empty that now. And now I'm going to turn the stopcock off to the fluid. So I'm fully primed, the whole stopcock, the whole system primed and ready to go. And now we're ready to hook it all up. So our patient comes up with the Swan, which has all these different ports. And we're going to now have to hook everything up to the correct ports. So we will start, as long as we got this right here, we'll go ahead and start with our coset. And the coset is going to get plugged into this blue lumen here. So I'm going to just take the very end of this, plug it right into the CVP lumen, which says proximal injectate right there on the port. So that's where this one's going to go. Make sure that it's off to the fluid. And then I'm going to take my pressure tubing, gotta find the right one. Okay, so again, this is the CVP, so I can use the vamp. And I'm gonna take my pressure tubing, if I find the end, and plug that into the side port on here. And now this part of it is good to go. Make sure that, again, double check that this is closed, this is empty, we're ready to go. Okay, and now I just need to plug in my PA pressure, which has no vamp. I'm gonna plug that in to the yellow lumen, which says PA distal right on there. Now, of course, normally this would be sterile. You would have caps on it, all of that. You take them all off as need be. And this is pre-primed by the provider. But here I've got my PA distal lumen. I'm gonna just plug this straight into there. And that part will be good to go. This is my balloon port here. I'm gonna just double check that I have an empty syringe. This is a 3 cc syringe, but it only allows you to draw up 1.5 cc's. That syringe should always, always be empty of air, and we wanna keep the gate open, which is when these little lines are, these little markings are in alignment with each other. That's an open gate. That means that the balloon at the tip, all the air has to kind of escape and go out into the syringe. So we have no chance of accidentally wedging there. Then our last little bit is we got to plug in our temperature monitoring systems. So from our adapter cable, we have 2 things to plug in. One is the inline temperature sensor. It's going to go just below the big syringe here. And we're going to put this in here, and you have to really push hard on that to get it to go in. Okay, so that's the inline temperature sensor. And then the second piece is this cable that comes off the very end of the adapter cable. That's the thermistor. And I'm going to find this little thermistor adapter. These can be various colors. I've seen them red, gray, white. and yellow. So I've seen various colors. So you just figure out which color you have, and then we're going to plug that in tight and then screw it on, and we should be good to go. So at this point, we'll now go up to our monitor. We'll level and zero all of our pressure sensors, and we will be ready to go to check a cardiac output as ordered. If you have any questions or issues on this, we're working on a policy, and the policy should be out very shortly. And we also have a job aid here on how to set up pulmonary artery monitoring. And then we have on the back side of the job aid is a few tips and tricks for how to do the process, which is beyond the scope of this video, but we do have job aids and available references for you. And that is all you need to know.